Hi, and welcome to Momza Yoga. Today, in our second video in our series of mini workshops on pregnancy and prenatal yoga, we're going to discuss the pelvic floor. This is a very mysterious topic to very many people. I'm going to attempt to demystify it for you today. So we'll start with one of the very first questions, which is, what are your pelvic floor muscles? Or maybe more specifically, where are they? So I'm going to show you in this diagram here, and also with my pelvic model, that the pelvic floor muscles are a series of muscles that hang sort of like a hammock off of the insides of the hip bones. There's many layers of pelvic floor muscles. Today we're really discussing the inner, deepermost layers. Of note, a lot of people will tell you that you do Kegel exercises by squeezing the muscles that you would use to interrupt your flow of urine. That's not really what I'm talking about today. That hits the outer muscles down here, and that's not really getting you what you need when it comes to having a well-toned pelvic floor that's going to help you get a baby out. So today we're not talking about Kegel exercises, and we're not talking about interrupting the flow of urine. So just kind of wipe that out of your mind for right now. The next major question to tackle is, why do we need healthy pelvic floor muscles? Well, a lot of reasons. We need a well-toned, healthy pelvic floor to hold our urine. We need it for more comfortable sex. But today, I really want to talk about how it can serve us in making room for the baby in the pelvis and in getting the baby out of the pelvis when you're delivering your baby. Very briefly, I'm going to demonstrate to you with my pelvic model and my baby's bath time doll, which is actually a little bit soggy right now from the bath, why having appropriate well-toned pelvic floor muscles is important for helping the baby deliver. And when I say well-toned, I mean that these muscles can stretch when they need to stretch, and they can contract when they need to contract. They're not balled up and tight, and they're not loose and stretchy. So I'm going to show you with the pelvis and the baby a little bit about why having well-toned pelvic floor muscles is important for helping the baby get out of the pelvis. So the largest part of the baby's head is here, yeah? And the largest part of mommy's pelvis as the baby's entering the pelvis is the lateral, the left to right diameter. So your little kitten is up here in your tummy, and they start to come into the pelvis. They need to turn their head so that the biggest part of their head is lined up with the biggest part of their pelvis. And then they enter and they start to wiggle and squiggle and rotate about. They go through a bit of a journey rotating through the pelvis. Then, as they start to get to the outlet, the pelvic outlet where the baby's going to come out, they notice, oops, the biggest diameter of the pelvic outlet is the anterior posterior, the top to bottom, right? It switched. So now baby has to rotate again. Went in like this, and now they've got to make a rotation so that the largest part of their head lines up with the largest part of the pelvis, right? Babies make a lot of maneuvers to move in and out of mom's pelvis. The reason the muscles are important is because, remember, within this pelvis we have that series of pelvic floor muscles. And if they're tight, very, very tight and contracted, right, then it's difficult for the baby to get through because those muscles have to stretch and open for the baby to get out. If they're very loose and lax and floppy, the baby can't really push up against them to make those rotations. The baby has to sort of go up against the pelvic wall, bounce back, find the other pelvic wall, bounce back. The baby has to have a little bit of resistance as they journey through that pelvis. And if the muscles are just loose and squishy, it makes it much harder for the baby to find a good position for delivery. And the opposite, if it's really, really tight, then the openings in those pelvic muscles that let the baby out won't let the baby out as easily. So that's a little bit about why having a stretchy as well as a strong muscle is so important for your delivery. So as we move forward in talking about how to keep our pelvic floor muscles healthy, we need to learn a little bit more about anatomy. This is where watching the previous video about spinal alignment, the pelvis and the spinal alignment might really come in handy. If you haven't seen it yet, I do recommend that you take a look at it. It should be, I think it's 8 minutes. It's a very short video. But here's the quick and dirty. You have a respiratory diaphragm and you have a pelvic floor. And they should be lined up underneath each other. As you breathe in, your diaphragm moves down and your pelvic floor moves down. It stretches. As you exhale, your diaphragm comes back up and your pelvic floor comes back up. Breathing in, the diaphragm goes down, the pelvic floor goes down. Exhaling, the diaphragm moves up and the pelvic floor moves up. They're constantly moving in concert with each other. And as that pelvic floor moves down, it's stretching with a deep breath in and it's contracting with your exhale. During this whole time, you might see a little bit in the schematic here, the abdomen is softening out as you inhale. The abdomen comes out, the pelvic floor goes down. The abdomen comes in, the pelvic floor comes up. So you can imagine if we're taking normal, healthy, deep breaths, that pelvic floor is constantly being exercised. It's stretching, it's contracting. It's stretching, it's contracting. But here's the problem. The problem, like we discussed in the previous video, is that when our pelvis doesn't line up with our spine appropriately, right? So say our pelvic floor is way back here and our spine's out here, then that's not happening, right? This beautiful up and down massage of the pelvic floor isn't happening. So spinal alignment is very, very important to making sure that your pelvic floor is stretching and contracting as it should. If you want to refresh a little bit about how to find the proper way to line up your hips and your spine, watch our first video. But basically, the cliff notes are that if you were to put your hands on your hips and start to rock your pelvis forward and back, you want to find the spot where the tailbone is not sticking out behind you. You're not sticking your booty out, nor are you tucking it underneath, but it's somewhere in between. It's not tucked under like a seat, and it's not sticking out like you're wearing 10-inch heels. It's somewhere in between. And that's going to make sure that our respiratory diaphragm and our pelvic floor are lined up right on top of each other and moving with the breath. There are lots of reasons why many of us are walking around with this weird pelvic floor misalignment, where women were wearing heels, we're holding in our tummies. Oftentimes we're sitting in chairs all day, which means we get up and we tuck our tailbone under like this, as if we're still sitting. We hold tension, and when you're holding tension, just think about it. How many times a day are you squeezing your butt cheeks, right? If you're squeezing your butt cheeks because you're tense, you're angry, you have to pee, guess what? You're tightening your pelvic floor. So all of these things in our modern culture, the spinal misalignment, the way we sit, the way we hold tension, the shoes we wear, sucking in our tummies to be beautiful, this tends to have a net result in the pelvic floor being clenched up, being high and tight. Now, it's different for every person, of course. Some people have the opposite issue where it's just really loose and lax. But by and large, many of us just have a really imbalanced pelvic floor. It's high and tight and contracted. And so when we're talking about preparing for childbirth, I don't really think it's a very good idea to talk about doing more pelvic floor exercises that would tighten the muscle. What I like to talk about is balancing the muscle and bringing tone. There's a series of stretches that are very good for this. We're going to talk about them in the next video. But today, I want you to understand that simple spinal alignment and breathing properly is going to go a long way to rebalancing those muscles and helping them release and contract and release and contract with every breath. So what I want to walk you through today in the next few minutes of this video is how to feel where our pelvic floor muscles are, because many of us just don't have that physical awareness. And then how to sit and breathe in a way that will balance them. That's all we need to do, really. We don't need to do Kegels, and we don't need to hold on to them and sit in the car when we're driving and hold on to our pelvic floor muscles. That's not going to serve us. It may be detrimental. So one of the first things I like to have people do when they're trying to figure out where in their bodies their pelvic floor muscles are, if they're trying to really be embodied and know how to sense them, right, in a physical way, is to actually sit in a child's pose. If you're pregnant, if you're having heartburn, if you're just nauseous or whatever, make sure your knees are really wide apart and maybe rest your head on a bolster. You don't have to have it all the way down on the ground. The idea here is that you're stretching your gluteal muscles when you're sitting in child's pose. A big mistake many of us make is that we squeeze our butt muscles and we think, okay, that's my pelvic floor muscles, right? We do that trick that everyone tells us to contract the muscles that you would use to stop your flow of urine, and that typically just results in sort of squeezing all the outside perineal muscles. People often mistake squeezing the gluteal muscles for their pelvic floor muscles. So when you lie in or sit in child's pose like this, we're actually sort of turning off the gluteal muscles. It's very hard to contract them when they're stretched in this way, and that may help isolate the deeper up pelvic floor muscles for you. So you can try taking this child's pose, and as you're lying in this child's pose, I want you to do the following with your breath. Bring your eyes closed. I want you to just gently inhale, letting your abdomen soften outwards. Let your belly go, don't hold it in. And as you exhale, I want you to just gently let your belly pull back in. Inhale, the belly moves out. Exhale, the belly moves in. Take 5 more rounds of this, only focusing on your abdominal muscles. Just gently release the belly out on an inhale and gently pull it back in on an exhale. Just get used to this rhythm. And now we're going to add the pelvic floor. So if you can imagine that hammock of muscles that's draped between your hip bones, if you can imagine as you inhale, your belly will move out, and now those pelvic floor muscles are going to release down or away from you. They're stretching. It's not a push. You're not pushing them out. You're releasing them. And as you exhale, belly will move in and the pelvic floor will move up. Inhale, the belly moves out. The pelvic floor releases outward. Exhale, the belly moves in. The pelvic floor moves up. You may take several rounds of this to get that coordination. Most of us have never done this before, and it may take you a while until you even feel like you know where your pelvic floor muscles are. But keep working like this, especially letting the abdomen release and the pelvic floor release, and then bring the abdomen in and the pelvic floor back up. There's a little rhythm to it, so if you feel like you lose the rhythm, just stop. Take a few cleansing breaths and start again. There's no pressure, and there is a learning curve. This is one of the very first steps I like to give people to learn about how to move and tone their pelvic floor muscles. Now, there's one more trick that might work better for you. In that instance, it is to do malasana, or a squat, with a wall as support, seated on a block, which I'm going to show you here in this video. So to get into malasana, you're going to have your block on the middle level on the floor. You're going to start with it maybe 6 inches to a foot away from the wall. It depends on your body. You're going to have to move the block back and forward to get the right distance for you. You're going to slide your back down the wall, and you're going to gently sit on your block. Your toes are going to be at 45 degrees, okay? We don't want them way out. We don't want them super parallel. Just about 45 degrees. And you're going to place your palms together at your heart center and use your elbows to gently support your knees. Now you're in a seated squat at the wall. Be mindful in this squat, you don't want to be hunched over like this either. So you do want to have a long spine here. And you're going to do the very same breathing exercise I just taught in child's pose. You're going to do that in your squat. Sometimes it's easier for people to feel their pelvic floor releasing and contracting in a squatted pose because the pelvic bones are stretched open here. They're released open a little bit, which means that it's stretching the muscles. And sometimes it makes it a little bit easier for you to feel them like that. So we're going to do the same breathing exercises that we did in child's pose in malasana, or squat. You're going to inhale, let your belly release out. At the same time, your pelvic floor releases down towards the ground this time. Exhale, the tummy moves in and the pelvic floor moves back up. Inhale, belly moves out, pelvic floor releases down. Exhale, belly moves in, pelvic floor rises up. And you're going to go on and on with this, just practicing. Where do you feel your muscles? Do you feel them releasing upwards and downwards? Can you feel the belly moving in and out? And if you can get your head around how to make this motion happen, then you're basically toning your pelvic floor muscles with every breath you take. Try it throughout the day as you're sitting, as you're standing in line, cooking in the kitchen. Just say, first ask yourself, am I squeezing and grasping, and can I let go? And then ask yourself, can I practice releasing my pelvic floor up and down with my breath? In our upcoming videos, I promise you I'm going to give you a lot of really fun, juicy stretches that are going to probably feel pretty good if you're pregnant, and they're going to help tone and rebalance your pelvic floor muscles. But for today, your homework is simply to breathe. Watch our first video, learn how to stand properly, and now you've learned how to breathe properly with your belly and your pelvic floor, and that's going to go a long way towards helping you have a healthier pregnancy and delivery. I hope you enjoyed this video about the pelvic floor. I hope you learned something helpful today. If you did enjoy it, please consider liking and subscribing. Thank you so much.